And do the same thing with this that we did with this. So this has to be filled with, I wonder if it'll do the other way. I don't think it will. No. This has to be filled with the IV fluid, all right? Let's make sure we do that. Let's make sure we do that. And I'm gonna see if I can find something else that will work so that you guys can experience this getting flushed. All right, so I've got this set aside, and I would have this attached, all right, to this, because I know I'm gonna wanna flush it, the IV once I've got the catheter in the arm, all right? I also, when I go into the patient's room, I usually have some kind of underlying, like a blue pad or something, because sometimes things can get a little bit messy and you don't want to have to change a bed. So I have a pad underneath the arm, all right? I've got my catheter here, all right? You got that? Got my catheter here. And I'm gonna open it up, and remember, I've got like padding underneath so that it just stays relatively clean. This is not a sterile technique. Also, these are small gloves. I normally would take medium, but I would make sure that you wear gloves that allow you to feel the best, and this is probably, the ones that would work best for me, because these are small, but they're fitting not too bad. All right, so I've got this, and then I've got my RV Start Kit. Now they've actually got gloves in here for me. I've already got them on. They've got a little label. They've got some tape for me. They've got some gauze for me, because I just want to know what they've got here. It looks like this is a Band-Aid. I guess if you need to take it out, here is an alcohol pad. And here is a PVP pad. All right, and iodine ointment. Ew. A lot of stuff that you probably are not going to necessarily use. All right, and then this is your tourniquet. Now remember what I said earlier. You're going to view the arm first, just to see how things look. One more thing, and sometimes you'll find these in the kits, and that's the clear dressing. Okay, sometimes they'll be in the kits. For some reason this wasn't, or maybe it fell out. When I'm doing this, I like to have it ready. Don't drop it on the floor. I like to have it ready so that I can immediately put it over once I've done it. And so as you peel this off, there's going to be that sticky part right here. So don't lay that down, or you're going to contaminate it. But I do like to be ready so that I'm not having to fool around, with the patient's IV, and I don't pull it out. All right. Okay, so I've looked at my arm. I don't like to choose these veins up here, but because I'm going to get flash from them, I hope I'm remembering the right one. I think I think it's this one right here, if I'm not mistaken. In the hospital, they also have a vein finder now where you can actually rub it over veins, and you can see if there is a good vein available for use. Do I like it? I don't. I mean, it gives me an idea of where a vein might be, but when it comes right down to it, I'm going to tell you the best way to find a vein. Look at me. Close your eyes. Am I right?
Yeah.
Because your eyes will fool you. Your fingers will not. So that's how I do a pulse too, especially if I am counting a pulse on a baby, the baby's heart rate's really, 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 really fast. All right, I'll close my eyes. I can count a lot better when I close my eyes. You can feel a lot better when you close your eyes, because you're not counting on your sight. You're counting on what you're feeling. So close your eyes. at least try it. Some people don't have to do it. I mean, just for me, I like to do it, and then I can follow it up with my eyes maybe. All right, but at first you can feel the veins a lot better than you can see them, because it'll fool you sometimes. All right, so I'm visualizing it. I want to double check to make sure that vein is good. So I'm going to tie it. And guys, it needs to be tied tight. Students sometimes are afraid to tie things tight because they're afraid to hurt the person. It's not going to be comfortable no matter what, happens. So I've looked at it and I go, yep, that's the vein I want to do. I'm going to loosen it up, all right, until I'm absolutely sure I'm ready to do this venipuncture, okay? I've flushed this line. So wish this would work. It isn't going to. I flushed this little piece right here, all right? I've got my IV catheter, and I need to clean the area. Now, I'm not sure. What are they using in the hospital? Are they just using the ChlorPrep, which I've got right here, or are they still using alcohol? This one, just this one, not any alcohol ever again? All right. So, and is that at Southeastern or Cape Fear? It's Scotland. They do this at Southeastern too. So we'll just figure it out when we go along, as we go along, okay? If you have something like this, you're going to squeeze it, all right, and it will break it open. And then there'll be a substance in here where you're going to be able to scrub. You've already picked out your site, and you go back and forth, and then you're supposed to do it like this too, right? Cross. All right. If you look at some of the videos, you'll see that they go like this. All right, and then, but you don't go like this. Does everybody hear me say that? Mm-hmm. Not from the inner part out. It's back and forth. And then if you look at some videos, I saw them doing this. Now, you should scrub for 15 seconds, and it should dry before you do the IV. All right, and as you can see, this is taking a while. Smells good. All right. All right, you're not supposed to do that. Don't do that, okay? Not that either. Do you want to hear a really funny story, though? All right, this is really funny, and I probably shouldn't tell it in front of Jalen and Keanu, but it's really funny. And I was waiting for it to dry, and I'm naive a little bit, okay? I don't have a dirty mind. I don't run around with a dirty mind. So it was not drying as fast as I wanted. This back up. Now, another thing that you can do at this point is actually attach this to your witchamahookie. I don't, but you could. And I think as you get more comfortable, you're going to find your own way of doing things. Okay. All right. So I've uncapped this. My little vein is starting to stick out. All right. And I'm going to do that beveled side up. All right. That's going to be much more comfortable for the patient. All right. So I found my bevel up. I'm going to take this. I'm going to pull down on the skin. All right. And then I'm going to go probably at about a 15-degree angle. Go into this vein right here. Come on, baby. Oh, there we go. And I hope I'm getting flashback from this one, and I'm not. So I'm going to try. I had it earlier. Oh, maybe. Ow. Do you see what I just did?
You stick yourself?
I stuck myself. great, I'll probably end up with some kind of weird disease. I want to see, this is, I know I'm not supposed to do that, but, all right, again, I want you to see the flashback. That's why, boy, these are, maybe I should have gotten a bigger needle.
Yeah.
This is,
Terrible.
but, all right, I'm getting flash, all right? It's not great, and blood is a lot darker and is a lot easier to see. So as I get the flash, I'm gonna advance this, all right? I'm gonna hold here. I can take this off, get that off as soon as possible, click this thing, bring it back, all right? I'm still holding because this is gonna keep the blood from squirting out. I'm going to try to advance that just a little bit more. All right. And at this point, I'm going to attach this, which isn't working. All right. But it's flushed. And I'm also going to have this clamped. Would you clamp that for me? That should be done beforehand. All right, put it in here. Take your Tegaderm that you've already got ready, and you can see why you would need it ready, right? Mm-hmm. Okay. And I'm going to place it over top of this right here. All right, make it nice and smooth. Don't cover this part right here. All right, otherwise you can't, if you had to remove this, which is supposed to be on there right now, if you had to remove this, you would not be able to. All right, I wanted to, all right, this is how it should look, y'all. Was I crazy?
You were doing that.
No, I was thinking about the flush. Okay, this goes on here, I'm sorry, all right? And then this can just be peeled off. And it's so old that, all right. So that's how it's gonna look. At this point, you want to go ahead and tape it down, all right? Make sure this piece is secure here, all right? And if you were to hook it up to an IV, you've got this primed, you've got this primed, and probably this is not going to connect with it either because our stuff is so old. Hit me. Because our stuff is so old, maybe this will. Nope, it's not. All right, so that's starting an IV. Now, the big takeaway here is I want you to know to prime this tubing. Prime the tubing. Start the IV. Make sure you don't have this tourniquet on your patient for too long because it hurts. And if you put it on and you're thinking, I'm ready to go, but then you're not ready to go.
Take it off.
All right, take it off. Exactly. And you can put it back on them, but it can hurt y'all for quite a bit of time. Now, if you are getting ready to remove the IV, you can take all this stuff off. Put this over here and just remove it. And then maybe this is what the Band-Aid's for. Now, from what I understand, you know that tape, that stretchy tape that's colorful that winds around